most of the time the parents are intelligent enough. They will come and tell you, Doctor Sahab, this child is not looking well. ये बच्चा हमारे को देखता नहीं है, ये बच्चे ने गर्दन नहीं संभाली अभी टाइम से, ये स्माइल नहीं करता, आई कॉन्टैक्ट नहीं करता. But sometimes as the child walks into the clinic, you can assess the behavior of the child, whether the child is giving any attention to you or he's just roaming around the clinic. So these are the, like many autistic children, when they come to your clinic, even before the parents, then you can judge that this child is not normal.
कि जब वो बच्चा एक सर्टन डेवलपमेंटल इश्यूज़ के साथ डायग्नोस हो जाता है तो वो काफ़ी पेरेंट्स ऐसे सोचते हैं कि ये कहीं ना कहीं वैक्सीनेशन का इसमें क्या रोल था. Hello and welcome everyone to the series of podcasts named Special Planning for Special Children. And in this particular series, we are talking about children, and that is going to be the future of our country. Today, I am pleased to introduce all of you with Dr. Vipin Vaish, who has been there into the city of Dehradun, which belongs to Uttarakhand. And earlier, the hospital was named as Vaish Nursing Home. Now it is renamed as a Meher Hospital. And sir has given more than 3 decades to this particular his practice. And today we are here to learn from him on a special topic about vaccination and early intervention, a pediatrician's responsibility, and how parents and pediatrician can work together on this particular topic. Thank you. So I welcome you, sir, for this particular topic.
Thank you very much. It's a privilege and a pleasure for me to be here on this platform. Thank you for giving me this opportunity.
So before we get into the topic, sir, मैं आपसे गुजारिश करूंगा कि अगर आप थोड़ा अपनी प्रैक्टिस और ओवरऑल बैकग्राउंड के बारे में बताएं कि पीडियाट्रिक ये फील्ड आपको कैसे मोटिवेट करता है एंड ओवर अ पीरियड ऑफ टाइम हाउ यू हैव इवॉल्व्ड इन दिस पर्टिकुलर फील्ड.
Actually, when I was a student, I was studying in school. So I learned this term pediatrician. So I was fascinated with this term. So after I joined MBBS, and my first posting in clinical posting was in pediatrics department. So from that day only, I decided that I will join pediatrics department. And it was always my aim to be a pediatrician, and it was a dream come true for me that I got selected. I got PG seat in MD Pediatrics, and so I've been working hard in this field since the time I joined MD Pediatrics. And I worked in government hospital in Delhi after doing my MD Pediatrics. I was in Hindura Hospital and Kastura, where I learned the basics of doing neonatology, because when I did MD Pediatrics, that time intensive care was not there. So I started learning intensive care, critical care, neonatology from Delhi. And after that, I started my own hospital in Dehradun in 1988. And that was the first pediatric hospital of its kind. And nobody knew what is a pediatric. Everybody was discouraging me that don't open a pediatric hospital. It is associated with such high mortality. How will you handle it? But I had determination that I have to start a practice. And that was the first of its kind in North India. That time there were no private pediatric hospital. And I started a neonatal unit in 1988. So everybody was not aware. Even in Uttarakhand, nobody knew what is neonatology. But I was there, and we had no neonatology nursing care, nothing. There was no staff. There was no trained staff. So I used to sleep in an ICU.
Okay.
And then I trained a lot of A&M. There are some basic health workers, and appointed them. Then I trained them how to feed the newborn, and how to give IV fluids, how to take care of the temperature, and how to give oxygen. And even oxygen was not freely available at that time. And we had just one closed incubator. And then gradually we developed this science. And now we have a hospital which has excellent care for newborn babies. We have a good NICU and PICU.
How many beds are there now?
Basically, there are around 50 beds, but our NICU has a capacity to take care of around 25 babies. And PICU is around 5 beds, because PICU is more labor intensive actually. So even if we have 5 babies in PICU, it is a lot of hard work actually.
Absolutely, sir. So it's been close to 37 years for you working in a city of Dehradun.
Yes.
Multiple patients have seen coming in and around
Yes, yes.
the city and from across the state as well. So before we get into the topic of vaccination and then the early intervention, I would like to know from you, since you have started the practice in 1988,
Yes, yes.
type of birth, if you see that time it was 70, 80, 90% of the children birth was normal with normal delivery.
Yes.
Now if you see and then only 10 and 20% was the cesarean babies. In the recent scenario, 80-90% of the birth are happening with cesarean deliveries,
The
and then
reason-
remaining are 10 to 20 with normal. So what could be the reason?
The reason behind that is because the parents are more educated and nobody wants to have a handicapped child actually, and nobody wants to take risk because even many patients, they come to the hospital and they say we don't want to have labor pain. But that's not the main issue. But the main issue is that the care for the newborn babies, because now with the time we have seen that there was very high incidence of birth injury. There was very high incidence of birth asphyxia, and so nobody, like even the parents, they have one child, and if they have a handicapped child, it's a painful experience for them. The life is totally gone for them. So nobody wants to take a chance, and even the obstetrician don't want to take a chance, because even there is slight complication in the delivery process. The patient, they will blame the obstetrician that because you did not do the cesarean time, that's why my child developed this complication. So multiple factors are there. Nobody want to take the risk. So we want to have a good healthy child, and we don't want to give any kind of handicap. So that is the reason why the incidence of cesarean is increasing, not only because the doctors want to earn the money, it is because the demand of the community has become like that.
Correct. So that's a good myth you have clarified, that it's not about the doctor earning the money, but it's about the preference of the
Yes.
parents and the family members.
Yes, yes.
So coming to the vaccination, sir, there are different types of children you must have seen, maybe early birth or premature birth, low birth weight, normal birth weight, and then the cesarean as well. So coming to the point where when the vaccination for the children starts.
So vaccination, we start from right from the beginning, at birth only. We start giving vaccine around 24 to 48 hours after birth. We try to avoid giving vaccine within 24 hours because the child is hemodynamically unstable. Once the child is hemodynamically stable, we start giving them the vaccine. So we give the first vaccine of BCG, and we give 1 dose of oral polio vaccine, and along with hepatitis B. We are not giving oral polio vaccine after that because our country is totally polio free now. And after that, after 6 weeks we give, and every 4 to 6 weeks we call the children for vaccination according to the schedule. And the giving vaccine, timely vaccination is important because vaccination is very important for the children, because to prevent so many complicated diseases and to prevent so much of morbidity and mortality in the baby. So vaccine is important. But besides vaccination, when the child comes to us during the vaccination time, we have a dedicated time for vaccination. And during that time, we are assessing all the growth and development of the baby. And we are talking to the parents, we are talking to the relatives individually. Besides assessing the growth and development, we also talk to the parents about their concern. What are the daily problems with the baby, day to day? And sometimes I tell the parents that you write down all your questions, and when you bring your child for the vaccination, that time you can discuss each and everything in details. And that is the time when we have to pick up any kind of disability in the child, any developmental delay, all the red flag signs. That is the time. So that is the ideal time during vaccination. We pick up if the child is growing normally or there is some deviation.
So if I have to ask about the pediatric practice or the office practice which is happening in our country, there if the vaccination is happening after every 3 months for that matter, maybe 3 months, 6 months, and as per the schedule.
Yes.
And so is the milestones of the development of the child.
Right.
So you can see whether at the 3 months the child is having a social smile, and 6 months the further development, and so on and so forth. So all these red flags, how much it is penetrated in the top of mind of the pediatricians, and how often they are getting discussed with the parents?
So, as far as recognition of the red flag signs is concerned, so it's a continuous process actually. Every time, because most of the children, they are coming to you regularly, right from the day one. Many children, they are coming afterwards also, but most of them are in regular follow-up. So children who are in regular follow-up, so every time they come to you for vaccination, even for when their trivial illness, so then you observe their activities, you observe how they interact with you, how they interact with the parents, is they having eye contact. But sometimes as the child walks into the clinic, you can assess the behavior of the child, whether the child is giving any attention to you or he's just roaming around the clinic. So these are the, like many autistic children, when they come to your clinic, even before the parent, then you can judge that this child is not normal. And during vaccination also, in the vaccination card itself, we have a developmental score, like milestone score, like we give a table for the parents. So they can also understand. And they will also tell many times, most of the time the parents are intelligent enough. They will come and tell you, Doctor Sahab, this child is नॉट लुकिंग वेल, ये बच्चा हमारे को देखता नहीं है, ये बच्चे ने गर्दन नहीं संभाली अभी टाइम से, ये स्माइल नहीं करता, आई कॉन्टैक्ट नहीं करता. सो दीज आर द रेड फ्लैग साइंस. सो एवरी टाइम व्हेन दे कम फॉर द वैक्सीनेशन एंड फॉर द visit, we have to carefully assess if there is any kind of a development delay or not.
Correct. So, as you mentioned, sir, the role of parents is very important to understand and come forward discussing about this पर्टिकुलर पॉइंट. सो एक कॉन्सेप्ट देखा जाता है कि कोई भी पेरेंट आपसे आके डिस्कस करने से पहले विद इन द फैमिली डिस्कस करता है. तो उसमें ग्रैंड पेरेंट्स देन बाकी रिलेटिव्स भी इन्वॉल्व रहते हैं. सो ये हमेशा कहा जाता है जैसे कि एक सिंड्रोम, विद ऑल रिस्पेक्ट टू दी ग्रैंड पेरेंट्स, दादी माँ सिंड्रोम काइंड ऑफ स्टफ होता है कि वो दादी माँ बोलती है कि अरे तू भी बचपन में ऐसे ही था, या ये भी ऐसी ही थी, और या फिर इसका चाचा मामा कोई रेफरेंस देते हुए अब धीरे धीरे ठीक हो जाएगा. डॉक्टर के पास जाओगे तो ज़्यादा क्वेश्चंस आएंगे.
नहीं, ऐसा नहीं है. बहुत बार ऐसा बोलते हैं लोग, ऐसे पेरेंट्स. पर आजकल के पेरेंट्स, दे आर वेरी इंटेलिजेंट एंड दे लर्न. मोस्ट ऑफ देम आर वेरी इंटेलिजेंट. और आजकल गूगल सर्च पे करके लोग पढ़ के ही आते हैं पहले से हमारे पास. तो मोस्ट ऑफ द टाइम द पेरेंट्स विल से कि देयर इज समथिंग रॉन्ग, बट मेनी टाइम्स it is the parents are not aware. So during the visit, it is the role of the pediatrician to point out to them that no, this child is not normal, there is something wrong, you have to take care. And especially children who are in autism, because the incidence of autism is increasing every day. I see around every week it is very, like when I was doing my MD, I didn't knew what autism was, but now I am seeing around two newly diagnosed children of autism every week. And I have to tell the parent what is autism and what. So I have to make them aware this is autism and tell them that this is the time you have to intervene. Just don't sit back and say that this is not right diagnosis. You have to accept it and you have to face it, and then you have to make sure that the child is giving early intervention therapy, occupational therapy, so that you improve. Because earlier the better. Because if you do intervention earlier, it is better. Because the brain is growing. And that is the time there is plasticity of the brain. So if you act early, the better is the improvement. And the parents also have to be aware so that they just don't take things lightly.
करेक्ट. सो सर, इसमें मेरा एक क्वेश्चन था आपसे कि काफ़ी ये मिथ है पेरेंट्स के बीच में कि जब वो बच्चा एक सर्टन डेवलपमेंटल इश्यूज़ के साथ डायग्नोस हो जाता है तो वो काफ़ी पेरेंट्स ऐसे सोचते हैं कि ये कहीं ना कहीं वैक्सीनेशन का इसमें क्या रोल था, पॉजिटिव था, नेगेटिव था, नहीं था.
वैक्सीन के लिए अधिकतर लोग कहते हैं, लोग एमएमआर के बारे में बहुत ये मिथ था कि एमएमआर से ऑटिज्म हो जाता है. बट दीज थिंग्स वी हैव टू क्लैरिफाई, वी हैव टू एजुकेट द पेरेंट्स. So there is the role, like we have to constantly educate the parents, and through giving them the evidence. We have to give them evidence that there is no such thing. It is like by chance there is some coincidence that because of the vaccine the child has developed. So we have to constantly educate the parents and give them evidence and tell them that this is not correct and prevention is better. So we have to reinforce that the role of vaccine, because it is very important to vaccine the child timely. Otherwise, many of the children, they will suffer because of lack of vaccination. Like there are some communities in even in today, who are against vaccination. So we have to constantly educate. And then they come with dreadful disease like things like diphtheria, which is not heard of nowadays. We hardly see cases of diphtheria, but sometimes, occasionally, we come across a child suffering from diphtheria, and it is such a dreadful disease. And even anti-diphtheritic serum, which is not available because this disease is so uncommon, very difficult to get anti-diphtheritic serum. So then we educate them that this disease can be prevented. So you have to give the vaccination timely.
So, sir, इसमें अभी if I would like to ask you regarding the case where the child is suppose 20 months plus, 20 months old, and still having only 15 to 20 words to talk about. So, how you will be diagnosing this as a speech delay? Yeah, what are the steps you will be taking in this?
So actually, we have to see whether this is just a pure motor delay, or it is an intellectual delay, or if it is a global delay. So these things we have to assess. And sometimes a pediatrician, a busy pediatrician may not be able to differentiate, but he will just understand that something is wrong. So then we have to take care of experts. Like we have to refer the child to a developmental pediatrician, occupational therapy, and speech therapy. So we have to work in collaboration. So sometimes it is not possible for a pediatrician to handle everything on his own. So we have to work as a team. So then the results are better.
Correct. What is the role of school or the teachers in this?
School teacher is very important because the children also listen to the teachers more than the parents many times. So and teachers has a very important role to play. So many times the teacher will tell the parent this child is not doing well in class, or there is decline. Suddenly the child is doing well, and after some time the child started having worsening in the academic performance. So then the teacher will point out to the parent that something is wrong, and you please take the child to your doctor and find out is there anything wrong. So sometimes even in my clinic, I get patients like this. So then I have to talk to the teacher, and I make it a point that I get the number of the teacher and talk to the teacher and discuss with her, because she has a very important role to play.
Correct. And what is the role of nutrition in all the developmental?
Nutrition is the fundamental thing. So because the most important, like besides the genetics, some genetic things you cannot change, but a thing like epigenetic is there, and nutrition can change the outcome of the child. So right from the day the child is implanted in the womb, so the first 1,000 days of life is very important, and nutrition has the major role to play. So we have to make sure that the mother gets adequate nutrition during pregnancy, and after the birth. So immediately after the birth, the child should get breast milk, adequate breast milk. First 6 months, the child should get exclusive breast milk, and there is no comparison of breast milk. Even the companies are trying to emulate breast milk, but nobody is successful as till now. So we make sure that I am looking after preterm babies, and from the day one, even if the mother is producing 1 drop of breast milk, we make sure that we give it to the baby. We apply it in the oral cavity so that the microbiota will change. And after that also, the nutrition has very important roles. Many times we see children who are having like neurological handicap, and they are not able to take adequate nutrition. And many times we have even gone up to we are putting gastrostomy tube, like we put a Mickey button and make sure that the child is getting. And many times we have seen dramatic results, like the child improves, the neurological outcome also improves. If we supplement adequate protein, carbohydrate, and trace elements, especially like iron, iodine, zinc, so these are all very important aspects.
Absolutely, sir. And as you mentioned in detail about the role of pediatrician, role of parents, role of teachers and school for that matter, even I have seen the role of your support staff. Because your support staff, they are working with you for many years.
Right.
So when you said you are busy in your practice, the support staff can also support you in.
Right. Yeah, this is very important. Like especially like when we are working in the clinic, the paramedical staff is there, the nursing staff is there. So they are also helping the parents. And especially like a lactating mother, she needs a lot of psychological support. So the nursing care has a very important, and we have to make sure that we have one person dedicated for that, making sure that she's encouraging the mother to breastfeed the child and teach her how to express the breast milk, even if she delivers a preterm baby. So all these things are very important. So the paramedical and the training is important. So we have to make sure that we have to train the paramedical staff constant. We have to make workshops for them and training for them on monthly basis.
So one thing, sir, I have understand during our discussion is without a specific reason, if there is no change in the location or for that matter, a parent should not change a pediatrician for the children.
Yeah, this is always advisable, because if they do medical shopping, it is not good, because it always creates confusion. So make sure, like sometimes the child is not improving. So the parents, they tend to change doctors, but it is not. I always tell them, suppose you are going to a doctor, the child is not improving, you must go back to the same doctor, because he can review the patient again. Otherwise, if you go to different doctors, end up doing unnecessary investigations. It is not good for the baby in the long run. It is better that you stick to your primary physician.
And he knows the history of
Yes.
the child. So one thing I would like to tell even the viewers that Dr. Vipin Vaish is a senior pediatrician, and his son himself is a pediatrician now, Dr. Hans Vaish. So I have seen there are certain patients who are coming to him only. There are certain patients who are coming
Yes,
to
yes.
you.
The newer generation people, the young children, they are now looking after. Like some children, they prefer to going to him also, because they say, we want to go to a young doctor.
Okay, sir, looking at your experience and the complete care which your Meher Hospital is offering in Dehradun, if the viewers wants to reach out to you, what are the ways how they can reach out to you?
So we have the website number. They can contact us, and even on WhatsApp, because there are a lot of patients I'm doing teleconsultation also, and they can talk to me on my one telephone number. They can talk to me, on my WhatsApp, because mainly I'm more comfortable with WhatsApp and telecommunication. So they can talk to me.
So with your permission, we'll just flash the
Yes.
number for their
Yeah,
reference.
yes, definitely.
Correct. So, thank you very much, doctor, for throwing the light on the role of vaccination along with the early intervention.
Yes.
Both these things should go hand in hand. A
Yes.
pediatrician should identify the red flags as well,
Yes.
and the parent should also tell all the complete truth to the respective pediatricians.
Right.
And with this, I would like to conclude this session by saying that you be very transparent, open, and express all your queries to your child's pediatrician. Don't change the doctor unless and until there is a mandatory need behind it, so that the doctor knows the history of the child and the holistic development of the child can be ensured. Thank you, sir.
Thank you very much. Thank you.